Welcome to our newest episode of the Lebanese Physicians Podcast. And today we will be talking about palliative care services in the Middle East and the North Africa region. Today we have several guests with us, all from the Research for Health and Conflict in the Middle East and MENA region project, which is a collaboration between the King's College in London and multiple other universities in the Middle East region. Our guests today come from London, Turkey, and Amman, Jordan. So first we've got Dr. Sabah Boufkhed, who is a lecturer in global health at the Humanitarian and Conflict Response Institute, University of Manchester, and visiting researcher in the King's College London. And Sabah is an interdisciplinary global health researcher who's been committed to social justice, and she's done a lot of research on palliative care services in the Middle East, the MENA region, the Asia Pacific region, and Africa, and on the effects of the COVID-19 pandemic on palliative care services in the region. Our second guest is Dr. Sema Yurdusen, who's a clinical psychologist currently based in Ankara at Ankara Bilim University. She, in her previous job, she had worked as a clinical psychologist for the pediatric oncology wards in Ankara, and has done a lot of research on the effects of cancer on child health, and has also been involved in the Research for Health and Conflict project in the MENA region. Then we have Dr. Fahad Ahmed, who's also based in Ankara, Turkey, and currently is an assistant professor of public health at Ankara Yilrim Beyazit University. And Dr. Ahmed has done a lot of research in both the Middle East area and also Pakistan. A lot of it is on palliative care services, also on vaccine services, and has been actually part of a WHO group on the polio vaccine in Pakistan in the past. And finally, we have Ms. Ghadeer Alarjeh, who's currently working at the King Hussein Hospital in the Center for Palliative Care and Cancer Services over there, and has been involved in a lot of the palliative care work at the hospital and with cancer patients at the hospital, and also in the Research for Health and Conflict group. Welcome, everyone.
Thank you.
Hi, thank you.
So I'm going to ask first Dr. Boufkhed. So Dr. Boufkhed, before we start talking about palliative care, I wanted to ask you, what is palliative care and what is its role in healthcare? Because I think a lot of people interpret palliative care in different ways, but if we can discuss that first.
Yes, thank you for the question. So there's several ways of seeing palliative care, and I think most of the time people see it as an end-of-life care, but that's actually going beyond that. So first of all, it's an essential health service under the universal health care, and countries should provide access to their population. I think my colleague would be much better at describing it, but the basic academic or approach to it would be to give you the WHO definition, which is basically an approach to health that aims at relieving suffering of people. So not only physical pain or physical symptom, but also psychological and social suffering, and also addressing their spiritual needs when they are in crisis towards quite difficult diagnostics. It's most of the time it's a patient-centered and a family-centered care, and it has a lot of interdisciplinary team working to take care of the patient's needs. So there's a lot of so some of them are actually here with us. So there's nurses of palliative care, psychologists, social workers, and I think maybe my colleague can say a bit more, as they would be practicing more than me.
Yes, Ghadeer, as part of the palliative care team and at King Hussein Cancer Center, can you describe to us what the role of nursing is in providing palliative care services at the hospital?
Well, as Sabah said, we are a part of the interdisciplinary team of the palliative care, trying to improve the quality of care and alleviate the suffering for patients and their families during the journey of their cancer trajectory, mainly because I'm working in cancer center. So we start with them from day one till after the death even, providing support for the family in their grieving and in their bereavement period. So we start to deal with those patients and families from the beginning till the end, till after the end, trying to support them as much as possible. And as well, I want to add that it's not only improve the quality of care for those patients and family, it's also reduce the unnecessary hospitalization and the use of healthcare services. And thus a cost-saving public health intervention can be considered. So I think palliative care should be integrated with other services from day one. Yeah.
Yes, and Sema, you've been a clinical psychologist in the pediatric oncology wards in Ankara. So how was your role in providing palliative care services, and what is your view of palliative care services for pediatric patients?
Yes, thank you for the question. In the place where I work, there is two separate parts that we are giving service to the patients. One was inpatient, the other one outpatient. It's not outpatients, but they are coming daily and going to their home daily. But in the inpatient service, they stay there approximately at least 1 week. So, as a psychologist, I am the only person who's from social areas in that setting, and the rest of the team are like doctors, nurses, and other stuff. So I try, as my role, it is me who mostly defines the frame of the service to those patients. Usually I try to know in advance at the beginning when they got the diagnosis. I make interviews with families and try to get in communication with the child. This setting is not very suitable to do weekly therapies or something like this, but they are coming and going in the chemotherapy treatment at different times. I try to talk to them from time to time whenever I can see them. It's not very consistent, but my main role is to make the connection first and try to tell them that we are around to meet their needs, to talk, or other needs, to solve the problems, to get them integrate the traumatic event and to cope with it during the treatment. It's my role, basically.
Thank you. And so I'm just going to discuss a brief overview of the advent of palliative care services in the West, because even in the West, it took a long time for people to start accepting these services, both in the US and the UK. Until now, I think there's people who still think that palliative care is just an end-of-life care for patients and not something that's a continuum of care for these patients. Maybe Dr. Ahmed, we can discuss this topic a bit.
Yes, thank you very much for this highlighting this point, because still now the people in the palliative care, when you refer the people for the palliative care, the family or the patient, they think that the hope is lost for them and they are just now left for dying. So the palliative care by its theme, it is neither for hesitating, neither for postponing the death. It is just to improving the quality of life of the patients and the quality of life of the caregivers as well. Because now, as you know, even in the eastern part of the world, the families are now moving from the Western styles. Even in the past, the peoples are living in the, what you call as in the rural areas, and everyone is caring for the sick peoples, and especially the women have been an important role for the caregiving. This was, I will talk, and it was actually the gender inequality in the palliative care, that the women take more responsibility to take care. But now, if you look for the eastern part, even in the Middle East region, or even in the Pakistan or in the Turkey, now the families are moving from the rural area to the urban areas, and everyone is working. So the focus of the palliative care that is now not only focusing on the provision of the care for the patients, but also for the caregivers, so reducing the burden on the caregivers as well. And this important point that it is needed to be described in the beginning of the treatment, that it is separated from the hospice care. It is not just only letting the persons to die. It is just not withholding or withdrawing the treatment. It is the integral part. It is including in the cancer treatment, or even for the any disease that have been chronic disease. Either it may be a communicable disease like HIV that makes time for the treatment and the healing, like tuberculosis, or even for the cardiac disease. So this is the important thing that needs to be clear in the mind of the population. And this is the weakest point in the region as well. Because the peoples, when you refer for the palliative care, they think that hope is lost.
All right, thank you, Dr. Ahmed. And one question I have is, when did palliative care services start taking shape in the MENA region? And what's the state of palliative care in the region? Maybe Ghadeer can start with this question as a palliative care nurse in Jordan.
For us in Jordan, palliative care started from a private foundation called Al-Malad in early 1990s. And after that, it took place at KHCC in 2003. And it developed after that. Well, in many countries in the MENA region, they have not yet considered palliative care as a public health need till now. So it's not included in their health care agenda, I think. Yet several initiatives and best practice have been developed in the region in many countries, such as our country, Jordan, Saudi Arabia, Oman, Qatar, Morocco, Lebanon, and Egypt. However, those services have been in a large part restricted in reach and not fully integrated into the national health strategy. They are mostly delivered for cancer patients in our country, not for all patients, and mainly in tertiary cancer center, our tertiary cancer center. So in the capital, Amman. So it's a little bit restricted for those group of people in Jordan.
So you're saying it's restricted in Jordan?
Well, it's not delivered for every patient, as I told you. Mainly, it's delivered as a well-developed, structured palliative care, mainly in KHCC. Some services are delivered in another governmental hospital, but not structured as KHCC. So it's mainly in Jordan, delivered by KHCC and some private foundation that take care mainly of cancer patients, adults and pediatrics.
And Sema, how are the services, or how is the development of palliative care in Turkey at this point?
Okay, maybe Fahad might explain better than I, but as a psychologist, I will try to say what I know. I think it is a new thing in Turkey, this palliative care service. The history is not very old, maybe 20 years ago it first started, and recently after 2010 it gets better in different hospitals, but still needs more way to go, because even in our hospital there are structural deficiencies persists. Like I am the only psychologist there, but we have difficulty to collaborate with dietitians, pain management, sometimes difficulty. I mean, not all the time, but it needs more time to establish a more collaborative approach to give service to those patients. I suppose Fahad knows the history better than me. Maybe we can explain more.
Yeah, Fahad. So how is it progressing in Turkey, or is it just limited to certain cancer centers at this point?
Actually, when you look for the development of the palliative care in the Turkey, it was actually in the same time when the palliative care concept was emerging in the Middle East and North African region, MENA region. And it was actually in early 19s, there was the Middle East Cancer Consortium that was an intergovernmental organizations between 6 countries in the region. And the interesting thing was there, the countries are very politically opposite to each other, like Palestinian Authority on one side and Israel on the another side, Turkey on one side and the Jordan politically on another side. But this intergovernmental organization was actually the basic point for the starting of the cancer registry in the regions and for the development of the palliative care and the cancer control, development of the cancer control program in this region as well. So in the Turkey, the palliative care services started with the provision of the pain treatment in early part of the 1980s or 1990s. And then there was a establishment of the pain control department in the hospitals for the treatment of the cancer pain. But later, this was after Middle East Cancer Consortium, Turkish Oncological Society Group, and the various NGOs, they had played an important role for the development of the palliative care in the Turkey. And by the time of 2005, the Ministry of the Health had taken the interest for the development of the palliative care and the cancer control program under the umbrella of the Ministry of Health. And if you go back in the time, the first policy document for the provision of the palliative care comes in 2010 by the development of the nationwide program for provision of the palliative care known as the Palliative program. Although it was on the document for 1 year, but it has moved from the policy to the establishment of the palliative care departments in the various tertiary hospitals in major cities. And currently, when you look, there are various sorts of the regulations for the provision of the cancer pain treatment with the opioid medications. And now the medications are available with the social security coverage, and the doctors have no problems on prescribing the opioid medications, and the patient have access to the pain medication easily with this. And also the home healthcare services had been integrated in the palliative care component. So the social services patient can be achieved, because one of the major component of the palliative care is to move the patient from institutional settings to the home settings to reduce the burden on the institutions. And we had seen this at the time of the COVID-19. And no, not all the patients need the home care, but might be some specialized palliative care department might be needed for some patients. So the Turkey have the both component, the palliative care that is provided in the institution, the palliative care that is provided in the home. And one of the major model of the palliative care that was established in the Turkey and by the Palliative program was a community palliative care program. So that have the primary healthcare physicians are also trained for provision of the palliative care in the Turkey. Although there are some disadvantage of the programs as well, and there are some limitations, but currently there is a specialized palliative care department in the Ministry of Health, and the number of the bed had been increased since 2015, and currently near 5,000 beds are available for just only provision of the palliative care. And the various teams are there, so including the psychiatrists, psychologists, pain medications, nutritionists, physiotherapists, and even spiritual imams or the spiritual peoples are there in the part of the team. But again, the services of the state-of-art services is only available in the major cities. So everyone is not able to achieve these services in the underdeveloped areas.
All right, thank you. And it seems like Turkey is maybe ahead of some of the other Middle East and North Africa countries in the provision of palliative care services.
If you look for the palliative care mapping that had been conducted by the World Palliative Care Alliance, I think Sabah will explain it more better. So Israel is on the top.
Right.
So they have the best, because there are various categories and through which the countries are being marked. So Turkey is on the level of the somewhat disintegration, but for the Israel, it is completely integrated into the primary healthcare and the universal health coverage. So it is on the top.
Okay. Yeah, and Sabah, that really brings me to a question. Since you have researched the provision of palliative care services in multiple MENA countries, and MENA countries are different, I think, in terms of their economies. Some of them are economic crisis, some of them are in conflict and war, how would you describe the continuum of services in these countries, or how different are they between the different countries? Is there a huge gap in services from one country to the other?
Yes, that's an excellent question, actually, because so one thing that, of course, everybody knows now, how the region is affected by conflict and economic crisis, for example, in Lebanon. So one thing that these conflicts have done is that they have weakened the health systems, and they have slowed down or even reversed some of the progress that were being made, in particularly cancer care in some of the countries. So in times of crisis or conflict, people move, obviously. And so migration within the countries and outside of countries pushes people into services that are not necessarily planned for that amount of people. So the demand in palliative care, for example, increase within countries, like in safer areas, but also, for example, Turkey and Jordan are major recipients of immigration. So that's creating a tension for health services. That's definitely one thing, but also there's one. So, for example, Fahad was referring to the global atlas of palliative care, and so there have been surveys, and so some countries like Palestine or Iraq have no access to palliative care within the country. So, for example, Palestinians have to go abroad. So either they can go to Israel or they can go to Jordan most of the time, but that also depends on authorization that they get internally. So that creates a lot of difficulties, for example, in that specific country. And there's also difficulties in accessing medicine. So, for example, in Syria, now that everything is disrupted, people who need palliative care would most likely go elsewhere, or they will have their access to care or medicine disrupted. But also the last thing is that palliative care specialists would go, there's not enough palliative care specialists in the region, and they would go away if there is a conflict or an economic crisis. So that's something that would be expected within the region, is that there's already scarce resources, and any tiny bit of additional conflict or crisis just makes everything worse for patients and families that stay there.
Yeah, and one question I think we didn't address too is, let's say when I was working in Lebanon a number of years ago, they actually the Ministry of Health passed a resolution that palliative care services will be paid for by insurance companies. And is this the case in Turkey and Jordan and maybe in other countries? Maybe we can start with Ghadeer. So in Jordan, Ghadeer, are palliative care services at the cancer center reimbursed by insurance companies? Because that's an important point too, because if they're not reimbursed, then only people with means can access them.
Well, for us as Jordanian, all patients, adults and pediatric, are fully financially insured for all treatment modalities, chemotherapy, radiotherapy, bone marrow transplant, and palliative care services, and home care as well. So by the government, they are fully insured. But for non-Jordanian, no, they have to pay, or sometimes they are supported by some foundation or charity organizations. So for Jordanian, they are fully insured to deliver any kind of treatment. Yeah.
Okay. What about in Turkey? Maybe Sema and Dr. and Fahad, you can address that question.
In Turkey, everybody has access to health services. That includes the hospital service for palliative care too. I'm not sure about the home services or the hospital services, but in the hospital, if they come there, they can receive medication support, pain management, dietary support, social support. They can receive those services. So it is also available for immigrants too. Once they immigrate to Turkey, for the patients, they gain some sort of privilege to gain from this health service. So once they are patient, it's, as far as Fahad, if I'm wrong, correct me, but it's free for everyone, as far as I know, for the students.
Yes, for the coverage of the clinical aspect of the palliative care, for example, provision of the essential drugs and the essential services, either by the primary care physicians or by at the specialized level of the palliative care, they are all covered with the social security system. And even the social security systems covers the home-based care and the home health services as well. But still there is a need for the coverage of the social services, because the palliative care patients need some assistance 24/7. For example, his or her nutritional need, hygiene need, moving safely in the home. So this type of the services are still burdens on the caregivers, because the home healthcare services covers some part of social services, but not whole part of the social services. For the whole social cares, still there is a burden on the health on the family members, including, for example, if the person had been have some special nutrition needs. So if the person is living alone, or maybe have the caregivers who are not very supportive, or who are living apart from their patients, so there is still need to be work on the broadening the social coverage. Although the clinical coverage is excellent and available for everyone, regardless of his immigration status.
That is great. And Sabah, is this the case in other countries in the MENA region? Do you know how insurance coverage is in other parts of the MENA region?
I have to say, I'm not sure. I can tell you that in the UK, it's definitely covered by the NHS and it's fully free. And for example, you mentioned earlier, like how it is in the West. So for example, in the US, it would depend of your medical insurance. So they have extremely good integrated care, but not everybody can access it. So I suspect that in the region, we would face very similar situations.
Exactly, I think so. And I think we addressed the question of, because I was going to ask the question for coverage for refugees in the area, and it seems that in Turkey, coverage and refugees have access to coverage for palliative care services. Ghadeer, is that the same in Jordan?
Well, as I told you, there is some kind of charities and certain foundation that have support internally and externally that support those refugees. But it's not for all refugees who can access this support. I think unlimited number of refugees here in Jordan.
And it seems like all of you, the reason we're all here today is because all of you have collaborated on multiple projects through the Research for Health and Conflict in the MENA region project. And so how did this project come about, or how did this collaboration come about to research palliative care services in the region? Maybe Sabah, you can start with that question.
So I may not even be the best, because I think my colleagues have been in the project before me. So I just took the train when it was already on the rail. So teams at King's College London have collaborated with teams at Hacettepe University and King Hussein Cancer Center. And so the idea was to address this huge research knowledge gap, which is what are actually the needs and concerns for patients in the Middle East, so that we can tailor palliative care and we can improve the quality of care that is already delivered in the cases of these two cancer centers. So I jumped halfway in the train. So they would have, if you want to know more about the history of the project, I may not be the best person.
So maybe Fahad or Sema, you can shed light on that aspect.
Actually, as the Sabah has mentioned, that this project was basically to identify the gaps for the palliative care in the MENA regions. So it was good with the collaboration. It was actually the good collaboration between the, what you call as the North and South collaborations to improve the capacity building as well for the palliative care. So the basic component for this project for the palliative care was that we are working on identifying the needs and the actually basically what are the needs and how we can develop some scale to measure their needs and how can we measure the outcome after giving their fulfilling their needs. So we actually conducted some interviews between the healthcare workers that include the oncologists and the other, as you know, that palliative care is a multidisciplinary team. So we included most of the people that are engaged in the delivering of the palliative care in the Jordan, in the Turkey, and also there are partners in the UK as well. And the basic, who is getting the care? Actually, we are focusing on the pediatric care. So we work on the pediatric component, and we had taken the interviews with the children. And thanks to the Sema, because she engaged with the children, and the interview with children is very difficult thing, because for even when you talk about the palliative care needs for the children as well, and also for the caregivers. So Sema, from here you can continue that what we come out with, and the Sabah and the Ghadeer made either for the informations and for the need.
Well, when I joined the project, it was 2018, and just a little, maybe 1 year before, it was already started by King's College and King's Hussein Center. As far as I know, this part of the project was one dimension of the bigger project. There is mental health dimension of it too. We are working on cancer patients, and some other projects are being done as well. So when we talk about palliative care, we mostly focus on cancer patients. I will just, before I thought that palliative care is available for everyone, I was only thinking about cancer, not all chronic diseases. So I'm not sure about that part too, but for us, we were wondering about what's happening, what are the daily experiences of those patients and their families during their cancer treatment, especially considering that immigration issues, economic crisis, political issues. How are they impacted by those things? The project was planned with such a thing in mind. So after 2018, I joined the team, and we made interviews with the patients, caregivers, and some of the staff who are working in the hospital to understand different perspectives of those experiences, those treatment and its effects, its psychological effects, financial effects, like social effects, everything, schooling, everything. So it took about 1 year to complete those interviews, and we all worked on it together to understand what are the concerns and needs. And like in the following weeks or months, we are about to publish it about most of the concerns that they expressed. There were lots of things that they expressed, but we tried to categorize and summarize them to understand what are the experiences and how are we supposed to give proper service to them. So it's almost finished. You will see in a couple of weeks.
Yeah, so basically, we're identifying a lot of the unmet needs for these patients, and hopefully work over time, probably work on improving these needs and fulfilling them. And during the COVID-19 pandemic, there was also a lot of research conducted on the potential for palliative care services to support the health system in the MENA region and outside the MENA region. So maybe Sabah, you can talk to us about the survey that was done on palliative care services in the MENA region.
Yes, so that was one of the things, this collaboration that we built helped develop. So first of all, we worked on a survey to assess how prepared were palliative care services to respond to COVID-19. So it started with a small study done in Italy when they started to have the first cases of COVID. So palliative care services mobilized quickly and started to quickly survey over the phone. And so we expanded it with the African Palliative Care Association, who had an incredible network of palliative care associations throughout the continent, and with I'm not sure for North Africa, but overall they have represented in every country. So we could survey and see how the palliative care services were ready and how they could reply. And so we tried to do the same in the Middle East, and it was much more challenging because there is no official network. So, and it was actually quite difficult to identify key stakeholders or key points of contact of palliative care services in the region. That's something we find really, really difficult. But overall, we managed to have representatives in 12 countries of the region. And so what we found is that overall, the palliative care services adapted very quickly by changing their protocols for visits, because obviously they're caring for highly vulnerable patients, especially cancer patients, for example. So they did adapt their procedure internally. They put in place infectious disease control, like having hand sanitizers and water and soap hand washing facilities. But also we identified that a third of them were worried about accessing basic hygiene products like accessing soap or disinfectant or even running water for some settings. So this, we found it was quite concerning, also because the people we managed to access were most likely the most developed of all the services, because we're based in the UK. So if we could access them, clearly they are highly connected. And most of the services we identified, they actually adapted very quickly and shifted to technology use. For example, they started to use the phone to like follow up with their patient instead of making them come in the hospital where they could potentially get exposed to COVID. So these are the really good things that happened. And in some specific places, like they actually helped other services to respond to COVID. And so what we found is that palliative care services have, for example, protocols to help people manage breathlessness at home. So these are things that are done, for example, I know in the UK, there is like a very simple leaflet that was distributed to patients, palliative care patients, and then the team scaled it up nationally to support other services. So what we found in the region is that the majority, not majority, like about half of the services were having protocols for symptom management that they could share with non-specialists. They were happy to be contacted to train non-palliative care specialists to do basic pain relief and accompanying patients, for example, in their end of life, because that was one of the key issues that came up with COVID-19. And also the other thing that they could help support with is triaging patients, because that's an expertise that palliative care specialists are able to do. So what we found is that if we had more integrated care, more integrated palliative care within health system, in a case of a public health emergency like this one, palliative care services could actually help non-specialists to address these end-of-life care that are unexpected, especially in COVID. I think it's all clear for us at this stage, I think, what I mean.
Right, because in COVID-19 patients, some of this could also be sudden. Somebody could be healthy and suddenly they're at the end of their life. So it's even maybe harder than other comorbidities or diseases that happen. So Ghadeer, how was the provision of palliative care services during COVID-19 at the King Hussein Cancer Center?
Well, it was similar to what Sabah had said. We used a virtual clinic and tried to contact patient all the time, our patients. Even the home care patients were contacted and they were allowed to contact the team anytime. And even the home care team for crisis visit, they continue to visit patients using the protocols and the isolation precautions and things like that. And also a lot of policies we have to, we modified it, like the DNR policy, do not resuscitate. So in case of, for example, the beds were full, we have to discuss the DNR code with those patients, COVID patients, in order to maintain the service as much as possible for all patients. And we also did a study, but we are still continuing it, studying. It's a kind of survey for healthcare providers to look for their mental health resilience and how the stress affected them during the COVID pandemic.
And what did you find in that study?
We are still analyzing this results. So when we publish it, I will send you the link. Okay.
Thank you. And So what are the next steps for palliative care research and collaboration in the region? And specifically, I think there was a study done at Beyazit University in Palestine. Can we discuss that study as we're discussing also the next steps for research and collaboration in the region?
So that's our colleague in Beyazit University. So it's a study led by Professor Rita Giacomo and Dr. William Hamoudeh. And so they are currently doing a similar study to what was done in Turkey and Jordan. And so they are assessing the specific palliative care needs and concerns for adults with advanced cancer in Palestine. And so because of the setting, they're going to look, on the top of it, they're going to look at the influence of the political economy situation in Palestine. So I think they are analyzing the data at this stage, and hopefully they will get some information soon. But so I guess that's something that we will highly follow up, because this is a highly interesting setting, because the provision of care for Palestinians is another level of complexity. They don't have care within the country, and these patients need authorization from the Israelis to cross the border to access care. So they will also explore how the experience of advanced cancer patient is in regard to that as well.
Yeah, that would be hopefully we'll get these findings soon afterwards. And so what are some future collaborations that are being worked on at this point?
So there are a few things that my colleague can develop on. So me on my personal level, also because I'm more global health than palliative care. So one of my major interests is to bring in the palliative care expertise within emergency response, because that's a field of research that has about 50-year plus experience in dealing with uncertainty, dealing with end of life and sudden diagnosis, and like having difficult conversations. And these are things that have a huge benefit for humanitarian responses or just emergency response. And we are working on developing, I think Fahad mentioned briefly, we want to translate the findings on children palliative care into having a tool to improve quality of care. So developing a palliative care outcome scale for practitioners in order to monitor and improve quality of care, both in Jordan and Turkey. I hope we have much more collaboration, and we hope that we will expand to other countries in the region. We discussed a little bit with Lebanon, but the situation in Lebanon, as you know through your podcast, is slightly complicated these days. And I will maybe the other want to raise the next step, because we've also done some work on refugees' needs of palliative care. And I think that's one of the findings that maybe I want to say a little bit more, is that one of the key things with palliative care services is obviously providing, there is a major pain, like pain management, that is a severe issue. And you mentioned the unmet needs for psychological care. And I think Sema is at the top of the expertise in this group on that. But also there's one thing that is highly important in the region, is that culturally, people rely on family support. And so when you have a lack of access to palliative care nationally, people have to move away from their social network to have access to care. So most of the time, the mother will travel with the kid in the big city and leave the family behind, or the father will also have to come, and sometimes they lose their job because they need to take care 100% of their time of their sick children. And so you can imagine, for example, one research of the team, and I think some of you have heard of that one, looked at refugees particularly, who already have trauma through the refugee process. And on the top of it, you get the diagnosis of cancer, and you have to take care of it. So it's just an accumulation of trauma for refugees that our study has looked at. But I think there's much more going on in Turkey and Jordan as well.
Yeah, can you tell us a bit, Sema and Fahad, about what's happening in Turkey?
It is not only for immigrant people, but also people who comes from outside of Ankara, because it's not a treatment that you go, get your treatment, and come back to your home. It takes time. It takes almost 6 months or 1 year, and you have to change everything to adapt to the situation. To find a home, to need more money to survive, to make the things normal for the sick patient to the child and the other children. So everything is changing. It is more difficult for immigrants. They already left their countries. They are already alone here in Turkey, and now they are more isolated from others because they have to be around the hospital in case of any treatment or emergency. So, the traumatic experiences are like accumulating on each other, and we as staff, like doctors or psychologists, are around to support them, to share their stories with them, to go this journey together with them, to make them think again, to make a little bit more normal. Our approach is this, and this applies both patients from out of Ankara or out of Turkey, for everyone.
And Fahad, do you have any additions to this?
Yeah. Currently, if you look in every country, not only this specifically in the Turkey, but in the region, there is a mismatch between the need of the palliative care and the supply of the palliative care to those who are in need. So this is the same situation in the Turkey, and to tackle with this, we need to train, as the Sabah has been mentioned, that during the time of the COVID-19, the need for the palliative care was more higher. And our region is prone for natural disasters and as well as the man-made disasters. So we need to train each and every persons in the health sectors, either it's the primary care physicians or the specialist or the oncologist or the nurse, to provide at least some level of the palliative care in his or her own work or in the specialty. So the most important thing that is going on currently in the Turkey is to incorporate or in some way to develop the framework for the palliative care capacity building in the healthcare systems by starting the palliative care nursing program had been started, but still there is the need for the specialty training for the palliative care program and incorporation of the palliative care in the graduations in the nursing and the medical professions. The second thing that in the palliative care that we told, we always said that the theme of the palliative care is neither to postpone or neither to hesitance the death. But at some point, the person comes towards the end of the life. So what about the end of the life care? This is very hard because there is no any concept of the hospice in Turkey. So truly speaking, there is no any hospice services. And also, there is no any legal arrangement for the DNR, do not resuscitate order. So what happened, the patient is discharged and now he is at the terminal stage. So when he have the severity of the symptoms, the family members do not bear the pain of the persons or the person not bear, and he come back again to the emergency setup. And from the emergency entered into the ICU. Until unless the human being will die on one day, how many supportive care you will provide? So there is no DNR, but unofficially there are a lot of DNR that are performed every day. So there is a need for legalizing the DNR order, and for this, there is also the capacity building is needed. So do not misuse the DNR order. And last time when we meet in the board meeting with our Jordan colleagues, so we were thinking of asking the community what they need at the time of their death, whether they want to die at the home along with their family members or they die separately in the ICU where their family member cannot see them. So what the person's own need at the time of the end of life care, what are the peoples are thinking. And another thing is the integration of the spiritual care, how we can include more spiritual care at the time of the end of the death. So these are the two topics for the future collaboration, I think, that with the Jordan colleagues we had discussed in the past. And at the level of the Turkey, the things that is going on in the Ministry of Health is to improve the knowledge of the palliative care among the Turkish society, so that the peoples will not misunderstand the concept of the palliative care. And also, along with the palliative care, as we say, is that palliative care should be started in the earlier part of the journey. But the problem is that the cancer is diagnosed late. So when the cancer is diagnosed late, the palliative care starts also late. So at the same time, we need to improve the knowledge of the early diagnosis for the cancer and the early integration of the palliative care in the cancer care.
Right. Yes. So it seems like the future collaborations will be important to focus on provision of services to areas that do not have services right now by actually training more people to have more people available in these areas, and then maybe trying to, even the areas where palliative care is present, trying to have services earlier, and also trying to push governments to pass laws for assistance with provision of services and for potentially hospice care. That seems like to be a big gap in some of the countries in the region. I know for a fact, I can give my experience in Lebanon, there were some individual efforts to develop several organizations for hospice care at home, such as Senad and Balsam, which I think prior to the crisis were pretty successful. I think they're struggling a bit in the crisis right now, but they were pretty successful from that standpoint at that point. So any other, I guess, and the only other thing I would say is are there any plans to have, as we discussed before, Fahad, to have more intergovernmental agencies to streamline the process throughout the countries of the region?
Sorry, I didn't get
Yeah,
your
are
question.
there any plans to have more like agencies across the multiple countries of the region to streamline the palliative care services across the countries of the region? As we discussed, Sabah was talking, for example, about Africa, and it was easy for her to identify palliative care services in most of the African countries because there was a way or an agency that connected all of them together.
Yeah, there was the work that had been going on. For example, there are like Middle East Cancer Consortiums, there are the cancer societies and multiple national cancers, UICC, and the many international organizations at the governmental and intergovernmental level. But after the COVID-19, the situations the focus had been changed. Although there is a need to increase the focus on the palliative care, but what I see is the focus had been somewhat shifted with the economical changes or the economical impact and the health system impact on due to the COVID-19. But again, I think it will be coming to the track because the palliative care is on the agenda and it is the human right. We cannot postpone the care in any way.
Thank you. Anyway, yeah, go ahead, Sabah.
Sorry. No, I just wanted to mention, actually, that has been something going on, especially with COVID. We, like at King's, because King's is a WHO collaborating center as well. And so the WHO is trying to do that, like the WHO Eastern Mediterranean Region Office, like EMRO. And so in 2009, they created a network in the region with experts. And so there is a hope there that there's like hubs, local hubs of expertise, because maybe one thing we didn't mention enough is that palliative care is highly culturally sensitive, and you want to take care of patients the way they want to be treated and not impose like Western models. In the Middle East, it wouldn't work. That's something that we're starting to see in our work, is that especially spiritual care is something extremely important, or at least spiritual support, and like the way you engage with people and the way you make decisions is more family oriented than in a very individualistic country like the UK or the US. And so having a local, starting with WHO initiative, a local hub of experts, international and national experts of the region, is a great start. But it is still the early days, and we've seen during COVID when we tried to reach out that it was quite difficult still to reach out palliative care patients. We started to have a repository, but unfortunately, as you know, like you need a little bit of funding and a little bit of work to develop initiatives that will help strengthen these networks in the region. So hopefully that's something that will improve in the future.
Yeah, thank you everyone for all the work you're doing to improve the services, palliative care service in the region. Anybody wants to have any final words?
No, but just I want to add something about the training and education and collaboration between the countries here. For example, at KHCC, we have a fellowship program for palliative physicians, and a lot of physicians from around countries come to do their fellowship program here, from Lebanon, from Bahrain, from many countries. They came to train for 2 years here to be a fellow at Palliative Department. And we have also academic training and education in the college and the universities. So I have just one thing to add. The results of our study will, I think, will trigger the policymakers because it will reflect the sound of, children, as well as refugees, those vulnerable groups who are rarely we have their voice in the research studies. So when we present those results, they will see that this is their needs and their concerns, and that palliative care also needed for this certain group of people, I hope.
Thank you. Yeah, thank you. And it was great discussing this topic with all of you, and hopefully we'll be highlighting more studies in the future as we discussed. I think there's a lot of work still ongoing at this point, and hopefully we'll have some more data and more actionable items for the future. Thank you.
Thank you very much.
Thank you, Khalil. Thank you. Thank you, everyone.
Thank you very much.